Hey everyone, and welcome to the Grow and Go podcast, where we address the topics that matter right now so that you can grow your caregiving knowledge and go forward with confidence. Today, I had the pleasure of speaking to Dr. Chirag Patel. Dr. Patel is the Chief Medical Officer for Pure Healthcare in Dayton, Ohio, the first freestanding palliative care center in the U.S. Pure Healthcare provides a centralized location for care coordination, early education, stabilization of chronic health risks, all while trying to focus on a person's unique care goals. Additionally, he is the medical director for Innovative Care Solutions and the regional chief medical officer for 5 Ohio's hospice affiliates. He is board certified by both the American Board of Internal Medicine and the American Association of Hospice and Palliative Medicine. So, with that, let's get into the interview. Okay, welcome, Dr. Patel. I really appreciate you doing this for our audience and for also being the first guest on the Grow and Go podcast. So thanks for coming.
Absolutely. Thanks for having me.
So the goal of these is to keep them short and sweet. We want to really focus on the topic at hand. And so, there's a lot of collective anxiety right now, obviously, and limits, the limits of our various systems are really being tested. I personally never could have imagined something like this happening in my lifetime. How are you kind of personally dealing with everything that's going on? What's your feelings on it?
Yeah, this is unprecedented. From a clinical perspective, and as a physician, we're all about objective information. We're all about testing and labs and good visibility into an illness state, right? So, what COVID-19 has presented to us is completely a novel, virus for humankind, right? So a lot of unknowns out there. So from a plan of care development perspective, that has led for me a lot of uncertainty. So best way I've dealt with is to take things day by day, right? Lean on our federal, state, governments to help guide us when it comes to treatment plans and how best to protect ourselves and our communities, from spreading. So I think in the end, just try to stay up to date with current literature, stay up to date with current, protocols and guidelines, evolve as fast as they evolve, right? Which is key because this virus is again evolving, as we understand it longer. So, again, as a clinician who's very objective and chooses to really try to find, the right path from an algorithmic perspective, it's been a really interesting time for all of us.
So you're kind of figuring out how to dealing with leaning on the federal government and the policymakers to really help us understand it and create protocols for it. How are you helping, families kind of deal with that same anxiety and stress? That fear of the unknown, the fear of the disease, the fear of the medical system being overloaded. I'm sure you guys are getting a lot of those concerns hit at you.
Yeah, and that we spend a lot of time, working through those concerns. Again, all healthcare providers want to do what they can, to do the best they can, and again, preserve life, right? And to do all they can to help make sure, each of our individuals that get faced with COVID-19 infections, have the best chance for success.
Mm-hmm.
So, again, we take things day by day, right? We just look at, what the CDC, with the Centers for Disease Control and Prevention, guide us toward. We follow our state health departments, findings. But in the end, it's about trying to stay calm, right? Stay, we're all fearful. But we're not wanting to let that fear become panic, because in that panic state, then certainly, bad decisions can happen. So I think, this state in particular, Ohio, which is where I reside, has done a phenomenal job in, planning, for that worst case scenario. So I think information is power. And, for those out there who are listening to this, it's the same, premise. There's a lot of stuff out there in media. We have all kinds of different media sources. Rely on your healthcare, providers to guide you through this. There's a lot of hysteria that can develop, and then that can cause, that chance for panic, which then could lead to a lot of bad decisions. So I think in the end, it's leaning on our federal researchers or scientists, who are working tirelessly to get therapeutics involved and get vaccines developed, build strong guidelines to protect our health.
Mm-hmm. And we've actually put per some of your guidance and some of your suggestions, we've actually gathered a lot of those links and resources on our website at caregiving.com and put them in a very specific place. So absolutely agree with that. A little bit more specific to you and your role, you're typically interacting with patients who have chronic diseases or comorbidities in many cases, congestive heart failure, diabetes, Alzheimer's. So these people are obviously at a greater risk when it comes to COVID-19 and outcomes. How has the support that you provide these patients changed, say, compared to a typical average American or average patient?
A lot of the data that's come out of China and other countries that were faced with this before we were in the United States, again showed a strong predilection for more severe illness, critical illness, and those folks that had multiple comorbidities, the ones you just mentioned, and of course advanced stage. So I'm a palliative medicine physician, so my specialty is in managing and supporting persons and families that have such chronic illnesses. So I think we've stepped up our game in a way to just again hyper communicate to our clients, our members, right, the ones that we're responsible for. So I'm a technology guy. I love technology and medicine. So we very quickly moved to a telehealth platform. So we have been engaging, much as we have been engaging, here in the office, in a similar way. So we're still doing things in a very multidisciplinary perspective. When I get on the call with a person and their family, my social worker comes on, my behavioral teammates come on, our occupational therapist comes on. So we have a unique experience for these individuals that we are privileged to serve. And I think that's just been what we've been trying to do. The same things I do to calm myself down, I do the same things for them. Just give them all the information I can have up to date, tools, again, to continue to fine tune their plan of care so that way they're comfortable and they don't have to go to the ER. If it's a cancer person with pain, I don't want them to go to the ER for a pain crisis, right? So we're aggressively, pushing our influence so that way we can capture those folks before they get into a crisis. We've done over 100 virtual visits. Again, in a couple of weeks, that's a pretty remarkable feat. Folks have just been just enamored with it. And in fact, as a clinician, right, I mean, you see people in our space, our office, but I've been toured around people's homes, right? I've seen their pets and animals. I've seen what is their home, right? So again, that gives me a different perspective on how how they live and cope, and how they deal with these type of stressful environments. So for me, it's been extremely enlightening to be able to get that lens into their world.
Like me, you're a technology fan, as you just mentioned. So, one of the things you mentioned were those virtual visits. Are there other things, kind of in the quiver that you guys are offering families right now as suggestions?
Again, connectedness is the key. So just as we're up in our game when it comes to our connections with our families, we're making more visits, virtually, just to keep a close eye on them, encouraging families to do the same thing, right? So there are, from a solution perspective, there's so many out there. And again, the easiest solution is to use a solution they have in front of them. So if it's an iOS device or if it's a Google device, use some of the the bidirectional video audio capabilities that are built into these tools. So some of the things that we've been talking about on our calls that we have as an organization are silver linings. And it's amazing, back when FaceTime and Google Duo and all that stuff came out, really, I mean, I thought those were just, just kind of, not ideal scenario. We have a phone, we just use your phone to call. But now to have that technology baked in to most of these platforms, right, has been really quite amazing. Again, you hear a lot of stuff about social distancing, and it makes sense, right, from an epidemiologic perspective, but it's more about spatial distancing, right? So don't socially distance yourself, but just again keep that 6 foot distance between you. So spatially stay apart, but don't disconnect yourself socially.
And it is a great point, and it's something I do want to address with you because I think there's a lot of caregivers out there that we have been spreading this message of social distancing and flattening the curve, and obviously in many cases those virtual visits help with that social connectedness.
Mhm.
The challenge, I think, for some caregivers and what we're hearing at caregiving.com is it would be great to socially distance and I'd love to support that. But as a caregiver, my loved one needs me for basic activities of daily living. How are you coaching in those situations?
And that's a great question, and it's a challenging one because again, that intimacy in a family, it's hard to break, and that's a key component for us to kind of weather the storm. Because again, this is not, from my perspective, in my opinion, this is going to be a long-lived, engagement until we get therapeutics and vaccines, right? So, what I recommend, when I talk to caregivers, especially looking after folks that are frail, is again, to be mindful, right? To look at symptoms, right? If a person develops a fever, so if you develop a fever or your loved one develops a fever, follow CDC rules, right? We need to somehow find a way to isolate those individuals, even though that feels very foreign because that's your family member. That's a key component to keep yourself well. In our family, for example, we've designated parts of our home that will be what we use for isolation. It'll be a specific bathroom, it would be a specific bedroom, right? We would not use, the same, same facilities, right? And we, make sure that we would try to do some sense of separation. If there is, if you are giving direct care to your loved one, there's, the data that's out there to the CDC. It's again, they call it prolonged exposure, right? So, 10 to 15 minutes, within a 6 foot, kind of distance is where, you're at the highest risk for capturing COVID-19. So if your loved one is symptomatic, the coughing, they're producing a lot of secretions, government's or encouraging us to use barriers, right? And we call that source control. So, put a mask on your loved one while you're doing that direct, care. So that way, if there's any secretions that are, emitted, they're captured by that barrier. Because the key is, we don't want both, everyone to be ill, right? So that, without you caring for that person, with the hospitals being, kind of in shutdown mode and ECS closing things down, you're really their last line of defense. So, to keep yourself well is key.
Right. And to build on that too, right? And we've even posted some videos on how to make your own masks and things if you can't get a hold of like a medical mask. What about cleaning and sanitizing? I'm sure Ohio's Hospice, Pure Healthcare has put in some protocols now in terms of sanitization of the folks going into folks' homes.
Yeah.
Is there anything around cleaning and sanitizing that you would coach folks on?
Yeah, so again, most household cleaners are going to be sufficient to kill this virus. So the key is to be aggressive about it, right?
Right.
So I'm not sure how most households are, but that's usually the last on most families' list because they have so many things to do in that day, right? So, I just will recommend to bump that up to the top of that list. So once you have a community, you're having dinner, right? You're preparing meals that you task somebody to be the one that sanitizes those high use surface areas, right? And doorknobs, switches, faucet handles, and just again be really diligent about it. And what I teach my team, I teach my the families I care for, the patients I care for is again you're your best defense. So understanding where you're at, right, making sure you're keeping yourself as distant as possible, which again is very foreign, from a family perspective. But wash your hands, for 20 seconds, many times a day. I mean, my hands are all cracked up because I've been washing my hands so much. And again, just don't touch your eyes or face, right? So know where your hands at all times. Don't go toward your eyes or face because that's how you're going to inoculate yourself. And if you are coughing, sneezing, use a tissue to capture that, right? If you don't have a barrier, and then throw that tissue right away. Don't put it in your pocket and use it again. So these are things, again, just from a personal perspective, are really key for each of us and across the country to do, because each of us have a equal responsibility to not to transmit.
Mhm.
Again, a lot of folks may be asymptomatic, and again, they don't know. We don't have lab testing, yet to the fullest extent to be able to test, 300 plus million people. But again, if we presume and be protective of our own personal spaces, right? Again, protect the environment they're around because we're again source controlling, mitigating, that droplet spread. That's going to be the best thing. But again, bottom of the list from sanitation, move to the top of the list, so that way that becomes a normal routine part of your day-to-day activities.
We reached out to our community prior to this interview and just asked if folks had any questions for you. And one of them had a really good question, Annette, actually on Facebook. She was talking specifically about nursing home staff and the folks there, but I think this could be applied really to all interactions with professional caregivers. How does a family member, how would you coach a family member to really make sure that their concerns are being expressed? So how do I make sure that the team and the staff are doing what I believe to be, like you just mentioned, those aggressive measures to make sure that we don't spread the disease or don't bring it into the home, even though they probably are thinking about it? Just what's a good way for them to express that fear?
That's a great question, Annette. That's a tough one because again, in this crisis, this pandemic, historic, right? We want to be kind, and I think kindness goes a long way. And I think that's the approach that I would take when I would, if I needed to challenge a person's presentation to my family member if they're fragile, right? So I would just politely ask, just again, I want to keep this environment safe. I want to make sure we minimize the risk of transmission, because when I go to the grocery store, I don't want to capture this, be asymptomatic, and then send this to a cashier, right? Because these are all very key important people in our economies for us to continue to live the life that we live, right? So
So, I mean, you yourself, and you don't believe any of the team members at OHI or Pure Healthcare would have any problem having an honest conversation like that with a family member.
No, I think, in fact, we encourage it because, as you've always heard, and you've heard our president say, we're all in this together. If we don't all equally take responsibility, we're not going to get through this in a way without a lot of loss of life. And, I don't think anyone has ever, faced such a global tragedy. So each of us have to be equally responsible. And if someone has a little slip, we got to encourage that person to say, listen, we're all in this together. We got to keep on the same path, led by our national leaders, the scientists and the clinicians who have been working tirelessly to get some information behind this, so that way we, again, as you said before, flatten these curves and assure that we never get to a place where we exceed our hospital capacities, right? And that's happening, right? So that's happening. People are doing what they're been asked to do, and it's showing a meaningful benefit to those curves. So we just can't let up on it, and that's the thing, Mike, is that we just have to continue to be aggressive about that. And I think, again, I think most people would understand that.
Yeah. I mean, no doubt about it, right? People are fearful. I myself and find myself kind of going out in public with the, holding my breath maybe more than I typically would. People are hurting, and, family caregivers are being challenged in new ways, right? That they've never been before. They're having to do things that they've never had to do, things that are foreign to them, as you mentioned. And many people are now finding themselves in a more kind of full-time caregiving capacity than they have before. So, with that, what's your outlook? I know you mentioned a little bit of it there, but maybe just in the next 6 to 12 months,
Yeah.
where do you see this going?
Yeah.
What can, maybe some bits of comfort or peace that you can give to folks just to keep in mind as we kind of move through this and move toward the future?
So I think we're through the worst of it, as long as we continue to do the things that we need to do, from a spatial distancing perspective, right? Our government, our local, health leaders, folks that create the tests for us. I mean, they're all ramping up significantly to be able to capture, if there's a next wave, which I think there will be, because, again, until there's good vaccination or there's something called herd immunity, which is, again, 2/3 of the population have to have immunity. This is something that's going to live in our ecosystem for a while. Um, so I think we've learned, just, I guess, a trial by fire, how to, again, to be distant, spatially distant, again, be really strategic when you go out into public environments, to be mindful of your location, your space, your hands. Um, and I think, again, as our therapeutics start to develop, as we get better, visibility within from lab testing perspective, we won't have to do a global mitigation phenomenon like we had to do this time around. We could actually do more, identify, then isolate, and then contact trace backwards. So the impact that it's going to have on our day-to-day, quality of life is going to be much less. Again, that's me, trying to be optimistic, but it's all of us working on this together. All of us, again, being mindful to our caregiver responsibilities. We all have that, right? It could be an elder, it could be a child, it could be anyone that requires your health, your presence, your spiritual peace, your coping capabilities to be able to continue to endure what we have to endure for the next 6 or 12 months. I think as the phases start to kind of level off, I think we're going to be able to do the things that we did, just late last year, right? So it's all about trying to stay committed to what we've started to do, which is, again, understand all the spatial distancing components, really strong, infection control protocols. The supply lines will start to catch up with the requirements for the personal protection equipment, and again, the hospitals have done an amazing job in building in capacities for emergencies, and the entire country sharing talent and resources. So again, a silver lining is that it's amazing how we have come together as a country. We have come together as a people. It doesn't matter your background, doesn't matter where you came from, what you do. We're all in this together. And I think if we all hold ourselves responsible personally to continue to do the things we have been doing, we will get through this. But it's going to take every one of us to believe that this is out there.
It's interesting, that those two silver linings that you mentioned. I think in times of need, I'm always inspired by the fact that the country really does seem to come together and support one another.
Yeah.
Again, like in the beginning, I never could have imagined a situation like this, but to see people politely distancing themselves on the sidewalk and giving a nod. It's like you do the Jeep wave. Everybody kind of is in the same boat, so we all understand it. And then two, this other thing that you mentioned right at the end, this could have a really positive impact on health care, health relationships, healthy living going forward. If we start to emphasize those things now, meditation, taking care of yourself, exercising when you can. I mean, obviously, in a time of quarantine, those things are huge,
Right.
but we should continue to really promote those. And it's one of the things I've been so fond of with you and the mission to Pure Healthcare is that's a big part of the core component there and the strategy. So thank you. I think this was a great message. I think the time was well spent. I think folks are going to really glean a lot out of it. And thank you for being guest numero uno on the podcast. And we'll have to get you back on to do an update maybe in a couple months.
Absolutely. Absolutely. Thanks for having me. This is great. Again, I want to, again, just reemphasize, we're all in this together, and I appreciate everyone's, dedication to that simple philosophy. And, we'll get through this, and we'll learn from this, and we'll adapt, we'll build better health policies. I think we're not going to forget this. We've had other, pandemic situations, with HIV/AIDS, with the H1N1 scenarios. But this is affecting the entire world, right? It has shut down airlines and cruise ships and restaurants, and there's will be long-term consequences that we're going to have to face. But we'll get through this. We'll build back stronger than ever, and we'll be healthier hopefully than ever. We'll have better health policies to help, if the next one comes through, how to deal with it at that point. But honored to be here, honored to be able to have a chance to talk to you guys, and
All right.
stay well, stay healthy, stay safe.
All right. Absolutely. Thanks a lot, Dr. Patel.
Thanks, Mike.
Okay, that's a wrap. First episode of the Grow and Go podcast. Thank you guys all so much for tuning in and listening or watching. Thank you to Dr. Patel for taking some time to sit down with us and speak to our audience about some of the issues, some of the concerns that I know the caregiving community has regarding coronavirus, COVID-19, and this pandemic. It's a stressful time for everybody. We understand that. We hope that this information, this resource provides a little bit of confidence, maybe some clarity around some questions or concerns you may have had. If you have any questions or concerns following the interviews today or going forward, please just share those with us either in the comments on YouTube or on the podcast app you're using. You can also share with us directly on the caregiving.com Facebook page or on the website. We'll try to get to those, summarize them, and maybe even have our guests do a follow-up where they can even address some of those questions directly in writing. One of the things we could really use your help with is disseminating this information. One of our goals at caregiving.com is to get people the resources, support, and information they need when they need it. And a big part of that is disseminating this content to the people that need it right now. So sharing the content via Facebook if you liked it, via Twitter, those are huge helps to us as an organization. Also liking and subscribing to the content as well. That lets us know that we're adding value, and it also will kind of self-promote when we do that and when we get that sort of traction. So thank you again for listening. Our goal is to support you all. So please give us some feedback. Let us know how we're doing, what kind of things you'd love, topics, experts, who'd you like to talk to, who'd you like for us to interview, and we'll make sure to prioritize that stuff because, again, this is for you. So thank you again so much, and we'll talk to you next time. All right, bye.